So I'm going to bring Dr. Nima in so we can get started. Dr. Nima, this is Fabi. She's a new patient to our office.
Good afternoon. How are you?
Doctor.
Thank you for coming.
So her last exam was a year ago. She's not having any pain. She said that she just gets a little food trap on the upper right. And her last cleaning was about 8 months ago.
Great.
Thank you.
Thank you very much. How was your day so far?
Oh, it was good. It's
Alright.
Halloween today.
All right. That is great. That is great. Okay. So before I start question, there's a few questions I want to talk to you about before I start my actual exam, and I'll explain to you every part of that exam. One, do you have any pain or discomfort anywhere?
It's just like she was mentioning, I get a little food trap over here on my upper right side.
Mm-hmm.
When I floss.
Uh-huh. And how often do you floss and brush?
Brush twice a day. Don't sometimes just when I get food stuck in there.
Okay, so let me tell you, 50% of oral hygiene is flossing. So if you don't floss, you are not taking care of what you need to do. So we'll get to that part in a second. Okay, other than that, do you have occasional gum bleeding? You don't have any occasional at all? No, even when you're flossing here and there?
Well, yeah, I guess when I go like weeks without flossing.
Okay.
I try to pass the floss there and
You should.
it kind of bleeds.
You
Yeah.
should reconsider it. And you said that your discomfort is on that. And also, is there any other place that you feel the food gets trapped in there?
Mostly it's just here
On the upper
on
right.
the upper right.
And is there anything you want to change about your smile? Are you something that you want to improve about your smile?
Well, not really. I'm okay with my smile. I know, like, I have this tooth that's a little short.
Uh-huh.
Previous doctors that I used to go to told me to get it removed.
Uh-huh. Okay, okay. And finally, where do you see yourself in 5 years from today? Regarding your teeth.
Regarding my teeth, cavity free, I guess.
All right. Very good. So that's something that we want to make sure we proceed with. Here, Fabi, we're going to start your exam with what we call mapping your mouth, which is technically called existing. We'll document what you have today, and we'll take it from there, okay? I was looking at your x-rays before I go further. I see that crown has a little problem, which I'm going to explain to you in a second why the problem we have that crown. Julia, existing. 1, 16, 17, and 32 are missing. We have crowns on numbers 3 and number 14. We have root canals on number 3 and 14. Composite fillings on number occlusal of number 31, 30. Also, composite filling on numbers 18, occlusal, number 15, MO, and we have mercury silver filling on the tooth number 19. Okay, so our exam has 3 parts. The first part is oral cancer screening. Second part is going to be checking your gums, and finally we'll look into individual teeth. That's how we are going to do the exam today for you. I'll explain every part as we proceed. So as I told you, the first part is going to be your oral cancer screen. So far, do you have any questions for me?
No.
I looked at your x-ray. The only area that I was concerned is the same area that you are concerned to, about the food getting trapped in that area. But we have to do a little bit more detailed look at it.
Okay.
Right, so ready? Let's do this. Your GP is kind enough to lift your chin up. Right? It looks like you're weighing like 80s today, huh?
Yeah.
Open, close, open, open big, close, open big, close. Yeah, that was my era actually.
Really?
I don't have to dress up. I am from 80s.
We had a theme going on at work.
Yeah, I can see. It looks, you really look bringing memories back to me.
Okay.
Yeah, you do really bring memories back to me. Wow. Time flies. Okay, Fabi dear, would you be kind enough? Pull out your tongue for me. Very good. Thank you very much. Open big. Very good. Open. Okay, go ahead, bite. Okay, Julia. Occlusion class 1. Slight grinding. You have slight grinding. Okay, now we're going to measure your gums here. Now this tool is for measurement of your gums. As you see here, it's color coded, so every part of it is 3 millimeter. 3 is fantastic. 3 to 5 starting to show some damages, and 5 plus we have serious problems. If you look at our chart up there, you see we have 1, 2, 7, 9. So that tells me where we're standing. Also, if you look here, it tells you this is a healthy is where we don't have any problems, and then we have gingivitis, and then we have periodontitis, which if you have any of those, I'm going to go explain to you what you have and how we do take care of it.
Okay.
Open dear. Okay, Julia,
Yes.
I have 4 millimeters on upper right side, anterior 3 millimeters. I have around 5 millimeter on the upper right side, left side, 5 millimeter lower right side, lower left side, sorry about that. And also we have around 3 millimeter anterior and 4 millimeter on the lower right side. Calculus slight, plaque moderate, bleeding slight. Okay, treatment for that area is going to be gingivitis, irrigation, and also laser decontamination. You can use the hygiene bundle also. Go ahead. Now we are going to look at every individual tooth. Ready?
Okay.
So you said you have a problem on your upper right side crown. So usually these food strapping is because how the tooth get together. So let's take a look with a low floss before I go further on. As you may see, the floss completely easily goes between your teeth. So you have opening between those two. When you have opening between those two, the food gets stuck in there. It will cause inflammation. It will cause decay. In result, you're going to have infection and lose the tooth. So that's very utmost important that we need to take care of it ASAP, which we'll get to it in a second. Okay, so 2 looks good. 3, build up crown due to open contact on mesial. 4 and 5 are looking good. 6, 7, 8, 9, 10 looks good. 12 is in good shape. 14 and 15 are good. 18 is good. 19, we have leakage on silver mercury filling. We need to redo it. Occlusal composite. Julia. 20, 21 looks good. 22, 27 looks good. 28, 29 good. 30 and 31 looks good. Orthotic device. And finally, for number 7, as she mentioned, we can have an implant. Veneer. Sorry. All right, so Julia,
Yes, doctor.
importance is, first of all, we need to take care of we need to do gingivitis treatment.
Okay.
After gingivitis treatment, we definitely, as fast as we can, the first available time that you have to take care of number 2, because that very concerns me.
Okay.
And finally, the orthotic device. Number 7, and then the orthotic device.
Got it.
Okay? That's our phases. Okay, Fabi dear, I am going to take some photos from your teeth, and we're going to discuss the photos together. Okay? So far, any questions, dear?
No. I'm good.
Thank you very much. Go ahead and bite. Smile. Beautiful. Beautiful. Smile. Thank you very much. Okay. So, first thing first, that's the reason that you came here, is the tooth that you have a problem with, the food gets stuck in you. As I explained to you, the reason the food gets stuck into that, gets stuck in that between those, that crown, is simply because there is a gap in there, okay? So when, look at me, if you have the tooth, there's a little gap in there, the gap causes the food to go in there and causes inflammation of the gums, infection, and also decay. And unfortunately, because the tooth has a root canal, you're not going to feel any pain on the tooth. You're going to lose the tooth. Okay, so we need to ASAP take care of it right away. Even we can start something today for you. Have you, as you heard, we talked about your gums. Your numbers around 4 and 5. And as you notice here, we have, that is where it is. So we have a little bit of tartar that causes the inflammation, and that is one thing that we need to do treatment for it. So for that treatment, one, we need to do gingivitis treatment, which has 3 phases. One, physical, we need to remove those tartars. Then we have to chemically use antibacterial, and finally use laser to do the whole thing together to reduce the bacteria and promote healing in your gums. As you mentioned yourself, the tooth in front, it's a good idea, as other doctors told you, to put the veneer to make it even with other teeth and make it look good. Okay? You have a very, very old silver feeling, as you may see, it's completely cracked on the old areas, and it needs to be changed because it will start leaking and causes decay, and as a result, you're going to have problems. And finally, as I explained to you, you grind your teeth at night, so you need something called orthodontic device because you have damage. You're damaging your teeth. You need to stop that, and the best way to do that is using an orthodontic device to prevent further damage to your teeth. Okay, Fabi, is there anything else you want to discuss with me? Is there any question regarding what I told you?
No, I think I got it.
Okay. Is everything clear for you?
Yeah.
All right, perfect. Is there anything you're concerned that you want more information about it?
No, I think you've answered all my questions.
Thank you very much for coming, and enjoy your Halloween.
Thank
In a
you.
minute, Julia will be with you to go over it. And as you notice, we phased out your treatment from the most important to others, the ones that are more concerned than the ones that are less concerned. Okay? So in a minute, Julia will be with you. Again, thank you for coming, and you look fabulous for your 80s. I know because I've been there. Thank you.